Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. I am Kurt Barwis, your host, and today I have a very special guest with me, Dr. Benzoni. Dr. Benzoni, how are you today?
I'm good, thank you.
Yeah. So you're a pediatrician.
Yes.
So tell us a little bit about yourself.
Okay. First, more than a pediatrician, I'm a mom. I have 5 kids of my own. I have 4 boys and 1 girl, and they're really what matters the most to me. But second to that, I am a pediatrician, and I've always loved children. In my high school yearbook, I'm not out with party pictures. It's always pictures of me carrying a baby. But I didn't think I was going to be a pediatrician when I went to college. I didn't think I was going to be a doctor. When we were in high school, we put down what we want to be when we're done with college or whatever, and I put down lawyer. But I took one political science course and said no.
So what was your undergrad?
Where or
what was it?
Biology.
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 So you were kind of naturally attracted to the sciences.
Yes. Definitely.
Yeah, that's great. And so have you always lived in this area? Or
No, I grew up in upstate New York in the Finger Lakes area, and if you've never been there, you should definitely go there because it is absolutely gorgeous. Yeah, people don't know about the Finger Lakes, but it's very pretty up there.
It's funny you say that. This morning I was looking at vacations, and there's a riverboat that goes on the Finger Lakes.
Yes.
And it's actually 15-day trip.
Oh.
I can't imagine unplugging for 15 days, but
Wow.
It actually hits every single one of the Finger Lakes.
Okay. Do they tote the boat from?
There's some kind of canals. It's a great question this morning. I read it, and there's some kind of connecting, like some sophisticated canal system they can get them through. But this one voyage left from Toronto, and then I think it was from Toronto.
Oh, that's the Great Lakes.
I'm sorry.
Not
I got the wrong lakes.
Yeah. The Finger Lakes are way different. The Finger Lakes are a bunch of lakes in upstate New York that are shaped like fingers.
Like fingers. Okay.
Yeah.
I really messed up there. Gee, that's horrible. But anyway.
But the Great Lakes are pretty cool too.
Yeah.
But they definitely are connected.
So there you go. That explains it. I have to read more carefully next time.
It's all in the same general area. Upstate New York.
So 5 kids, and you're from a family of how many?
I'm from a family of 10. Yeah. I know I couldn't quite meet my mom's.
but all along kids are a big priority. So then you said you were thinking about being a lawyer, you did biology, and then you just got this passion for being a doctor?
I never had a passion for being a doctor. I mean, that's the honest truth. I was very practical in my decision. I had to have something that would allow me to be independent and work, and I was good at science and I'm good with people, so this is where being a doctor. But my passion was more never to be dependent on anyone or anything. The honest truth, Wow. That I wanted to be able to make my own way.
So when you went to medical school, obviously you could have been any kind of doctor.
Yeah.
Right? So you gravitated towards pediatrics?
Well, I loved OBGYN too. It was a big decision whether to do OB or to do pediatrics. And I ended up doing pediatrics because I do love children. And it ended up being a good decision for me, for sure.
Yeah. Well, I think most of the people that I talk to would say agree with you 150%. including my assistant. So that she raves about the practice. So talk a little bit about your practice.
So the practice in Bristol, it was a partially established practice when I joined in October. And then what I've done, though, is I've added to it, and we really are booming. I saw 21 patients yesterday, which, that's pretty much a typical day for us. We have new babies all the time. We have a really cute little office. It's 4 exam rooms. It's done up really nicely. When you walk into the waiting room, somebody had a really good idea of wrapping a huge pipe to look like a tree. And so when I saw that, the first thing I did was I got some monkeys and I hung them from the trees.
You hung monkeys from the tree. I didn't know that happened.
Yeah.
So that's really cute.
I still would like to get like maybe some sloths and bananas and stuff.
Sure. So that was the Rosenheim Foundation
Okay.
donated. They donated $200,000 to renovate the office, and then they came up with, I guess the architects or the interior decorers came up with putting the tree in the waiting room. So
It's really cute.
So it must actually have branches because you've got
No,
monkeys hanging from it. How do you hang the monkeys from there?
It's very funny you asked that, because I was going to do double-sided sticky tape, but I had a little kid in the office one day, an 8-year-old, and I'm talking about, I don't know how I'm going to get these monkeys to stick. And he goes, why don't you use a glue gun? So that's what I did. I used a glue gun, and I adhered them
So the monkeys
based
are
on
on there.
that child's
That's
suggestion.
quite interesting. So talk a little bit about your practice and what you're seeing right now with kids.
So a lot of what I see a lot of newborns, which I just love because I love to watch that development of the parental relationship with their child and just the parental confidence. That's a really fun thing to watch over time. And what I see, I do a lot of anticipatory guidance. I talk to parents a lot about what to expect for the next stages of life. But I also help guide through a lot of feeding difficulties, because babies, when they're first born, they don't come with user manuals, and parents a lot of times are just not confident in their own ability to feed the baby, to care for the baby, and I do a lot of guiding for that. But I also do a lot of sick visits, coughs, cold. This season was a big RSV season, and we saw a lot of RSV. Not so much COVID, but a lot of RSV. One child was hospitalized with it this fall in practice.
Yeah, so it's really interesting you say, like, there's no instruction manual. I think if, I have 2 kids, and I would say this to people that are new parents, is like, you somehow everything happens just in time. Like, you learn just in time. Like, if somebody handed me a baby today and said, change the diaper,
You'd be like, no way.
There's no way. But back then, I think it was just like, I did it in my sleep sometimes. So
yeah. So one of the things I do say to parents, trust your gut, trust your instinct. Instinctually, we're all animals, and we're all geared and made to care for our young. So that's a really important thing, is to don't start second guessing yourself. Trust your gut when it comes to your child, and you'll do the right thing that way.
Yeah. So you practice in a building that's adjacent to the hospital, and what's kind of unique is you'll actually attend deliveries.
I do, but not when I'm in the office. But I do some coverage of the labor and delivery.
Yeah.
Families are first, you call it.
Yes,
At
families
Bristol,
are first, yeah.
Right. Yes, I have attended a number of deliveries there. It's very nice.
So it seems like, I remember when my kids, a long time ago, my kids were younger, so straight to your point, we would go for a visit to the pediatrician, and all of a sudden the pediatrician would leave the office and attend the delivery, and we waited for a couple hours. Yeah. But now all of a sudden, that's not what's happening anymore.
Correct. I mean, it's probably only been less than 10 years that that's been the case. It used to be that I always covered the delivery room from my office. But
So what caused that change? I mean, what do you think?
I think, the bigger hospitals started to hire full-time people on staff to cover, and I think just the standard of care changed. There are still some hospitals that do it that way.
Is that right? Yeah. I would imagine, rural or critical access hospitals, things like that.
They don't have a pediatrician or a pediatric extender on staff. Yeah.
But it certainly makes it easier, I'm sure, for the scheduled appointments you have in the office happen much more routinely than
Sure.
if you had to stop all of a sudden, say, I've got to go attend a delivery and come back. And I think, like you said, it's probably the practice change is a safety issue too.
Yes,
so having
sure.
a pediatrician right there at the delivery at all times is really very important. So then when you think about, like you said, RSV was a pretty common thing. and I've heard, a lot of other kind of illnesses. You mentioned COVID. Did we have like flu this year, or was that?
There was some flu. I didn't see a ton of it in the office. It was a pretty big, heavy flu year, but a lot of those kids end up going like on a weekend to the walk, and I don't have weekend hours right now. So they do end up being seen at MedHealth.
MedHealth, yeah. So I'm curious about something else. You talk about watching the kids develop, and, it seems like, and I go back to my time with my kids, and I was a baseball coach, and which I really never played baseball, but I got to be a coach because you do what your kids are doing, right? But I noticed like a lot of kids had, attention kind of deficits and other issues and things like that. And I learned a lot about it being in a community where there was really no psychologist. It was really, family physicians were diagnosing kids. How do you do that?
I see a lot of mental health issues in the office. It's actually probably my harder visits because they're very draining. Behavioral issues, attention deficit, anxiety and depression. We do see a lot of that, and I treat a lot of that. How do I diagnose attention deficit? You talk to the parents, you talk to the school, and then there are some very much formatted methods of doing it too, using the Connors or Vanderbilt to diagnose and get numerical data.
So from a parental standpoint, and this is kind of like what, and I've seen a lot of parents struggle with this. It feels like you go through this period of, no, that's just my kid. Yeah. And it's kind of, I don't want to say denial, but it is really a denial thing. Definitely. It's like, because everybody wants to have everything be perfect all the time. And
especially your child, right?
And then you realize through, you get the report back from the daycare center or the kindergarten that something's not right. And I think a lot of parents struggle with, so what do I do?
And struggle with accepting it. So so one of the things I always remind parents that teachers are on your side. Yeah. Teachers, they want what's best for your child. And I remind them they are comparing them to age-matched peers. My daughter's a third grade teacher. Oh. So I get a lot of that kind of teacher perspective. And I also have the mom perspective, and I have the doctor perspective. So I can come to it from all angles with these parents. But I do remind them that nobody is attacking your child. Everybody wants what's best. And when the child does get the proper treatment, things change for the child. They're no longer swimming upstream all the time. Yeah. They can have a more normal, happy childhood. A child with attention deficit, I think it's told over 2,000 times more that they're bad than a child that does not have attention deficit. So if you treat the attention deficit, that child is no longer being told that they're bad. And that's important.
It's really important. And so I was diagnosed with dyslexia, severe dyslexia when I was younger.
Another big one.
And so I know exactly how it felt. Mom got the report card home. I was reversed and everything, but they didn't know that. But this was before they really had those diagnoses. And so every summer I was in summer school, every single summer. And what was I learning? I was learning what I didn't comprehend during the year.
And it makes you feel dumb when you're not dumb. Oh. It's a different way of learning.
Yeah.
But these kids grow up thinking they're stupid. They think that they're not as smart as the other kids. And it really takes a hit to their self-esteem if they don't get help.
There's no question. So the thing that was interesting was my mom, being a nurse, was paying attention. She knew there was something wrong with me. And so she put me in as a guinea pig into a clinic at Temple University in Philly. I was one of the first 2 kids for a whole summer. Wow. They diagnosed me, and lo and behold, instead of me going to summer school to learn what I didn't learn during the year, they taught me how to learn. And that's where my life changed. And so I feel like I'm like the picture of what you really need to do is you stay after it.
But your mom trusted her instinct. You see? Goes back to that.
I can remember how she used to say to me, I know you're smart. I know you're smart, but I don't understand what's going on. And to this day, the skills that I learned, I use all the time because as I get tired or get older, it's harder. The other thing that has really kind of hit me over the years is the parents that don't engage and don't get the help for their child. When a child, so if a child has, for example, Asperger's, right, and they're on that spectrum, and they get to the point where they're no longer a child and they haven't gotten the help, it's a whole different world to deal with those kids.
Yes. So we don't use Asperger's anymore.
What do you?
It's
I'm
just
sorry.
autism spectrum disorder.
Autism spectrum disorder.
But I understand what you're talking about. And the kids with autism, I have a ton of kids with autism in the practice. And again, you start early with intervention, those kids' life can be changed. You get them into birth to 3. We test at 18 months and we test at 24 months for autism using a standard called MCHAT, and it's very high specificity and sensitivity. And even if the child's a little bit off, you get them into birth to 3, it makes a difference for the rest of their life.
Wow. So now you're saying that it's automatically happening on a regular pediatric
standard practice is to
it's a
test
standard
18.
practice. That's absolutely amazing. And so you catch it as soon as you can.
We catch it, and I can't tell you how surprised parents are when I have to very sensitively tell them, I'm concerned about your child, I'm concerned about this questionnaire that shows the child may be at risk for autism. No parent wants to hear that, especially when they see their child as pretty normal. But these questionnaires, again, are very sensitive.
Yeah, and as I think about like the kids that I know going through my lifespan, that actually have gotten the help, and a lot of these kids that are on that autism spectrum, thank you for correcting me, have a gift. They have an incredible gift.
Absolutely.
And you just have to figure out how to get to that gift and unlock it with the environment, because as you said, they don't feel the same.
To be very highly intelligent.
Right. I mean, and they're the ones that are writing all this code now and all this AI stuff. And anyway, so I thought, from a behavioral health standpoint and the diagnosis, I think that's something that parents struggle with. And I get a lot of questions about it. And I'm obviously you've been incredibly helpful in explaining it. But I think what you said is true. Like if you get it early and the parents kind of accept it, and it's pretty common, right? It's
very common. Yes. Very, very common.
Yeah. So what other things like that, that's just one that I know from interacting with a lot of kids, coaching a lot of kids to see it. Kids with obsessive compulsive disorder, which, that again can be incredibly, if caught early enough, can be helped. And those kids can get life tools that help them overcome just about anything.
Right, and it's not all medication either. A lot of it is therapy. For the kids with autism, when you get them at 18 months, their brain is very plastic. So you teach them how to talk, you teach them how to do tasks, and you teach the brain how to then readjust the way that it thinks, and they get to be like more normal. Some of these kids you can't even tell when they're in 4th and 5th grade that they ever had a diagnosis. That's the other thing. Parents are always very afraid of their child being diagnosed or labeled. Oh, that's going to single them out in school. It doesn't. It only helps. It only helps.
I think part of that has to do with historically, if you go back in time, like I can tell you, I went to a special school and I got labeled. But I don't think today that's true like it was back then.
No, I don't think it's true at all. In fact, getting this kid's help is really all you can do to make their life better.
And it's great. Like I said, I really didn't realize that all that testing happened in a regular, normal pediatric visit. So like when you think about like your wish list of things, like when you think about, you talked about parents and you love to see the kids evolve over time. Like if you had a wish list of things like you could get every parent to do.
Oh, thank you for asking that question.
I'm sorry.
Get rid of the screens. Get rid of the screens. Get your kids outside, okay? When you're outside, 5 senses are stimulated at one time. When you're on a screen, it's just your eyes. Screens are just horrible for all kinds of reasons. There's, one is the lack of stimulation. The other one is, we all know the dangers of social media, and kids get hooked on it quickly. They start to feel worse about themselves. But screens, reading, will cause so many neural pathways to open, and screens doesn't. If you look at the studies that have been done, MRI and MRA studies, and of kids that are, how many hours they spend on the screen versus how many hours they spend reading, the brain development is way above when you read. Get rid of the screens.
Get rid of the screens.
No child should have a TV in their bedroom. That drives me absolutely crazy.
I sound like my mom. My mom and dad, even to this day, we don't allow TVs in our bedrooms.
Yeah, and you shouldn't. But almost every child that comes through my office has a TV in the bedroom, and every parent says, "Oh, but they never turn it on." Then get rid of it. That's all.
That you can cut the box out and save some money, or cut the cable and stuff.
I have a Nintendo Switch. I have this. I have that.
Yeah.
I have my iPad.
I wonder, a lot of times I think about like playing outside. I remember growing up as a kid, playing with other kids, and you learn, life skills,
yes,
right? And you learn how to, you get through those arguments and through those tough times, because.
And you're not bored. How many times do your kids say, I'm bored. I always used to tell my kids, go downstairs and make a birdhouse then.
Make a birdhouse.
I would tell them, go get the spare pieces of wood and make a birdhouse.
That's so funny. I lived in a very, like, a row home neighborhood kind of thing. And anytime we got wood, we would build something out of it. We would absolutely build something out of it. But I worry, because I feel like today I hear a lot about isolation as a big issue. In fact, I know from EMS runs that isolation and depression is way, way up. And then, so I think your advice is really important. And the other thing I would say, my mom, because she worked, she was a nurse, there was always a list of things on the refrigerator for chores. And we didn't get paid to do those chores, but it certainly helped us figure out like how to do things like make a salad, take the trash out, set the dinner table, do the laundry. Well, I wasn't allowed to do the laundry, but yeah. But anyway, so thinking about your practice at Bristol Health, I mean, we're trying to expand that practice and hopefully reach more of the community. Any last minute thoughts to the viewing audience?
No, I think people don't know that office is there, because it's in an office building, where a lot of pediatric offices have a sign outside their office so people know that it's there, but people don't know it's there. So increased visibility would be important, I think. Yeah. And I think we're working on that in a lot of different ways. But it's the practice is there, it's growing, and I always have students. I love having my med students, and I have PA students, and I have a really excellent APRN student that's rotating through right now, and really hope to keep her. But
I'm with you on that one too. Okay. I heard a lot about your APRN student. You're directly across from the ER, right. So it's kind of easy to, if you follow the signs of emergency and you look to your left, it's there. So
and they have valet parking sometimes.
So Dr. Benzoni, this has been great, and I appreciate you coming on here this morning. And I think we covered a lot of ground, important ground, which is good for the viewing audience. So this is Bristol Health Cares, and I am Kurt Barwis, your host. We are in the Nutmeg Studios in Farmington. Nutmeg TV is a nonprofit organization, and as nonprofits go, it would be great for you to support this station, so that shows like this can be possible, and then those shows that you see about with all the different communities would be possible. It's a very advanced studio. They have a full digital cameras. All the production equipment, everything in here is absolutely extraordinary, and it's only made possible by donations and funding from various sources. So please write me at bristolcares@bristolhospital.org and cares@bristolhospital.org if you'd like me to bring on a different guest or another guest to cover a certain topic. Until the next time, this is Kurt Barwis signing off. Have a wonderful day.